evening, everyone. I hope you had a great day and are ready to listen to our presentation and our presenter tonight. And I'm sure that you have some questions that you would like to get some answers for. So we are here. And as you can see, Dr. Manuel Izquierdo is with us. Hello, Dr. Izquierdo. How are you feeling? Glad that you are back with one of the webinars tonight. How was your day?
Hello, Hello, good evening. Thank you for this new opportunity to share our knowledge and our experience in fertility treatments with all the people attending this meeting. Thank
Thank
you.
you so much indeed. Let me just mention that this is the second webinar with Dr. Izquierdo, and tonight we will talk about embryo donation. So first we will start with presentation, but afterwards, as I've mentioned, there will be Q&A session. So all you need to do is just type those questions in the chat section, and Dr. Izquierdo will help you with those. As always, don't hesitate. This is your time, and I'm sure that it's going to be very useful for you. Let me just add that Dr. Manuel Izquierdo, he's the Director of Medical Quality at IVF Life, located in Madrid. And I'm Caroline, your host, as always. So thank you, everyone, for joining. I believe we can go ahead with our presentation. Yes, Dr. Izquierdo, ready?
Thank you, Caroline.
Thank you so much indeed. And let's start.
So, good evening. The topic today will be embryo donation. Embryo donation compared mainly with double donation, egg and sperm donation. Receiving donated embryos is treatment sometimes our patients are asking, and I will try to explain you about the circumstances that make the most advisable treatment considering donation. Um, we will go through the definition of embryo donation and double donation. We will tell about what are the indications for these treatments, the main circumstances making good to consider these alternatives for trying to be pregnant. And we will explain the steps involved in embryo donation compared to double donation. For sure, we will need to tell you about the Spanish regulation for all these treatments. We've been a lot of years performing these treatments under Spanish regulation. We think our regulation is one of the most advanced in this field. And by the end, we will tell about some conclusions and general rules for trying to help patients in the decision of what treatment to go to. The first question was definition. Maybe you are thinking it's very clear. Uh, Receiving donated embryos is the adoption of embryos coming most of the times from the donation of other patients who have yet uh, fulfilled the pregnancy. Sometimes we are facing situations where we have more available embryos than the number of embryos the couple is going or the woman is going to use. And one of the opportunities here by the Spanish regulation is donate these embryos to any other couples or women. So we have here in Spain right now, only for you to know, about 80,000 embryos stored in our clinics in Spain from many years of treatments being performed. Most of these embryos are coming from couples not allowed to donate these embryos. I will explain later about the conditions for donate these embryos. Not all the people having remaining embryos they don't want to use are able to donate for other couples or women. And the alternative sometimes is a double receiving double donation. This is mainly trying to have embryos coming from the fertilization of donated egg with donated sperm. We will tell you about the main differences in these treatments. What are the main indications? Maybe we need to think about some situations that in which we need to have donated eggs at the same time as donated sperm. Consider or think about heterosexual couples when both members of the couple are suffering some conditions that make very difficult to get an embryo. The combination of severe male factor, think about azoospermia, very low account of sperm, very low quality sperm, makes our decision to consider sperm donation as an alternative. And if at the same time the woman is suffering a situation when the ovarian reserve is very low, and in cases of very advanced age, where the quality and when the quality and the quantity of these eggs is very low and bad quality eggs, the combination of both factors, or maybe coming as an alternative, is considering embryo donation or double donation. Uh, Other cases are like a single woman having the circumstance of going to get pregnant, not having a male couple, they need to go to a sperm donation. And then, if they are suffering the condition of having a poor ovarian reserve, advanced age, and or bad results from previous treatments, it will be another situation where embryo donation is an option. Think also about female couples. In Spain, is allowed to treat single women and female couples. And thinking in the case of female couples, when they both have eggs, they both have oocytes, but neither of them are good enough for having a good embryo to transfer. In this situation, there's needed to have donor sperm, but at the same time uh, donated eggs. And the last main indication I will tell, is sometimes when we are facing repeated implantation failures or repeated miscarriages, but uh, these are very few cases, because most of the times the first option, if we are telling about heterosexual couples, is try to change one of the gametes. Only for the previous situations and going to having the problem of repeated implantation failure or repeated miscarriages, make us to tell the patient about considering this double donation, embryo donation option. So embryo donation works very similar, quite similar to double donation. In this case, you must think that we have the embryos at the laboratory. We don't need to search for a donor of sperm, for a donor of eggs. we just have these embryos, donated embryos in our laboratory. So sometimes it is an easier and faster treatment because we have the embryos at the laboratory. At this point, I want you to know that sometimes we need embryos for a donation, but the phenotype characteristics we need to look for, I will explain later about this, is not as easy as when we are trying to search for an egg donor or a sperm donor. In egg donor and sperm donor, we can set quite similar phenotypes. In embryo donation, we are more limited uh, because of the availability of these embryos. But it's mandatory in Spain to look for uh, the more similar phenotype as the patient who is receiving this donation. So in embryo donation model, we need to focus once we have these embryos in the endometrial preparation. The endometrial preparation is very easy most of the times. Sometimes we even take advantage of the natural cycle of the woman. Think that every woman having regular menses is ready every month, most of the times for being pregnant, for the embryo implantation. So sometimes we take advantage of this endometrial uterine cavity preparation promoted by the natural cycle. But most of the times we take full control of the endometrial preparation. If we want to perform the preparation in advance and we want to set a day in the future for the day of the embryo transfer, we can set using hormonal preparation. This is very light hormonal treatment because we try to mimic to get a similar preparation like the body is producing in the natural cycle. So the basis of this preparation is mainly estrogens, the main hormone in the woman cycle, and these estrogens will promote an endometrial preparation. We can measure this preparation after 2 weeks taking estrogen pills. Most of the times we have available estradiol patches as well. So these estrogens coming through the skin or orally taken will get the endometrium to grow and having a good lining. We will measure by ultrasound scan, we will search for blood hormonal levels, and if confirmed, we are ready to implant these embryos once we start with progesterone supplementation. The key is having a good lining, but at the same time to set the best moment to start progesterone supplementation and having this progesterone for at least or for the same days the embryo is. This is the general rule. Sometimes we need to adjust the starting of progesterone in terms of very narrow windows of implantation, but the main rule is more or less the same days the embryo is. So most of the times we are telling right now about blastocyst stage embryos, day 5 embryos, and most of the times we need to supplement for 5 days before, with progesterone before embryo transfer. Embryo transfer is a regular procedure performed with not needing anesthesia most of the times, no pain. Is performed in near the laboratory for the embryo to not being out of the incubator for so long, and it's very easy to transfer the embryo and place guided by ultrasound scan. Most of the times there's no problem. So we have the needing of donated embryo. We search for this embryo. We prepare the endometrium. we prepare the endometrium and then we will set the embryo transfer. What are the requirements here in Spain? In Spain, this question is regulated by the Spanish law. Uh, Up to now, we had three main fertility laws in Spain. The last one is the law that was published in 2006, and is telling most of the requirements needed for egg donation and embryo donation. We consider the general conditions for donating gametes are the most required conditions for embryo donation. So the main requirement in Spain is for the female for donating gametes being over 18 and under 35 years old, and in the male being over 18 and under 50 years old. Maybe you are thinking about these differences. The main thing is that the male condition is about 10 years later about the quality of the gametes compared to the woman. Most of the donors here in Spain, sperm donors, are most of them under 35, 30, or 32 years old. Even is allowed to donate a sperm later or being older. And one of the main things we always tell the patients is in Spain it's mandatory to test these donors for infectious diseases, genetic inheritance for the most common circumstances, or genetic alterations. Here in Spain, for the gamete donors, it's mandatory to search for the condition of being carriers of cystic fibrosis, muscular spinal atrophy, for the woman X-fragile syndrome, some kind of deafness related with genetics, and some hereditary anemias, alpha thalassemia, beta thalassemia, etc. So we need to search for these circumstances. Proven fertility is not mandatory. It's not mandatory. It's true that most of the people donating embryos has become successful in pregnancy, but it's not mandatory. And for gamete donation, is not mandatory as well to have a proven fertility. In embryo donation model, sometimes all the requirements today are not fulfilled, but if they are not so frequent, we tell about the prevalence of the diseases. Informing the patient about these limitations is good enough for going with these embryo donations. But I always tell the patients that most of the requirements are related with trying to have the best probabilities of having a healthy child going to these treatments. And for sure, these examinations, these testing, are more than the ones we usually perform in the patients when we are using their own gametes. About the concordance, the matching with the donors, in Spain, the law is telling about a phenotype matching. This means we need to set as much as possible the race, the size, hair color, eyes color, and we tell about blood group concordance. At this point, I want you to know that blood group discordance or not matching is not most of the times a medical condition. It's more like a medical condition because if not matching the blood group with a couple's group, sometimes the child in the future, knowing the Mendelian genetic laws, could ask why I'm carrying a B group and my parents are, for example, A and 0 group. So there's no problem in the medical conditions most of the times, and we offer the patients blood group concordance, but considering this is not a medical question. So the first Spanish fertility law was set in 1988, and as I told you, the last law is coming from 2006, and referring the possibility of donating our remaining embryos if we are not going to use them. We have four options today: destroying the embryos, donating these embryos for research, keeping these embryos for the woman or the couple, just in case, and the alternative of donating these embryos to other couples. But it's mandatory the woman being under 35 and the male being under 50 years old. Very important to tell that Spanish law is telling about anonymous donation. Anonymous donation. Most of the countries in the south of Europe, the regulatory rules are asking for being anonymous. Anonymous means the patient will never know about the donor, and the donor will never know about the patient. But it's very important to tell that we need to keep the clinic needs to keep the record about this donation, just only because if in the future is needed to contact the donor for some medical question, we are able to contact because we keep the record. The clinical keeps the record and knows the donation, the donors and the receivers, and we will keep this record. It's mandatory by the Spanish law. It's voluntary and it's altruistic. In Spain, there's no payment for the donation. In the embryo donation model, it's, it's not a paid donation, and in the gametes donation, the only pay is in terms of compensating all the disturbances and coming to the clinic and being under treatment, etc. A few amount of money, a very small amount of money for compensating all the disturbances and all the problems getting to the clinic, traveling, etc. Sometimes we tell the patients about preimplantation genetic testing, looking for aneuploidies, hereditary diseases, other alterations that may affect the viability of the embryo. But at this point, the main thing is that if we consider the egg donors, for example, and embryo donation is needed, that the woman being under 35 years old and having all this genetic testing, most of the times there's no need to consider genetic testing in terms of aneuploidy, hereditary diseases, or other alterations. We consider this question in the beginning, and because all the legislation, all the rules here in Spain are going to the main goal is increasing because of the age of the woman under 35. Is going to have a very good options of this embryo to implant and high probabilities of not having an aneuploidy, etc., because woman's age is lower than 35 years old. So the main conclusions of getting to embryo donation is sometimes if we need double donation, the main approach is trying to get these donated embryos and make easier this process, and maybe sometimes faster because we don't need to generate these embryos from the beginning. And most of the times, these embryos are coming from couples that got pregnant, and sometimes it increases our probabilities because we are thinking if the embryos coming from the same donation and the couple got pregnant, or the woman got pregnant, maybe the remaining embryos are good enough for giving a lot of chances of getting pregnant. Very important to tell that not needing to search for an egg donor, sperm donor, making the work in the laboratory for fertilizing the eggs, waiting for the embryos to become blastocysts, etc. This treatment is cheaper than double donation. There's no need to stimulate any donor for obtaining the eggs. As I told you, we can think about going to a natural cycle endometrial preparation because we have the embryo in the laboratory, and we don't need to wait for the egg egg donor to donate, to have the retrieval of the eggs, etc. Total anonymity of the donation stipulated by the Spanish legislation. I told you about this, and the pregnancy rate is about 60-70%. This is the same pregnancy rate as the one we are having with double donation. The reason is very simple. The prognosis on the statistics of embryo implantation depends mainly in woman's age, and because Spanish legislation tells about the same condition, women being under 35 years old for egg donation or embryo donation, we get quite similar pregnancy chances going to any of these treatments. So this was the last conclusions. We as a group have clinics right now in Spain, Germany, and United Kingdom, and I'm open from now on to any question you are interested in being answered.
Thank you so much, Dr. Izquierdo, for taking us through the presentation and explaining what embryo donation is. And now it is time for your questions. There are some questions ready, but if you just joined, let me just add that if you wish to ask something, this is your time. Dr. Izquierdo is here, and we'll be happy to help you with some of your questions. And I think we can start with the first one that we have from M. Just give me a second. It's right here. Are there couples in your clinic willing to give up some of their embryos for adoption to other couples? Are there any waiting lists?
Yes, we have couples donating embryos, and most of the times we have no waiting list. No waiting list means that most of the times, in maybe 2 or 3 weeks, we have donated embryos for these couples. Remember, I was telling about a huge amount of embryos here in Spain coming from all of the years with fertility treatments, and we have a lot of embryos, and sometimes under these conditions the couples, the patients are donating these embryos. So no waiting list in terms of very small time for waiting for an embryo donation. And yes, for sure, we have couples donating embryos.
Okay, thank you for the clarification. And in case there is a waiting list, for example, how long usually that would take?
More or less 2 weeks or 3 weeks,
Okay,
no more than this.
not so.
Only regarding some ethnical
Yes, okay.
questions, or like Asiatic, black people, etc. Sometimes we need to wait longer, and we tell the patients about these circumstances.
Of course. So this is not even more than one a month, so it's not
Yeah,
that
yeah.
bad, I guess, then, of course. Thank you so much for explaining. And actually, the second question was in regards to the waiting list, so we know already. So thank you so much. And let's have a look. You also mentioned this in your presentation, but if you can just have a look, what is the pregnancy rate with embryo donation?
Yes, I will insist. Sometimes patients are telling about implantation rates, and it's good to ask for this. But the main message is uh, this is uh, this is related with woman's age, and the conditions for egg donation and embryo donation are the same in terms of woman's age, and egg donation and embryo donation are the higher pregnancy rate treatments all. So the answer is very clear: 60-70% with the transfer of one day 5 embryo. I want to add some question. Sometimes patients are telling, or if I don't get pregnant with the first embryo transfer, think about 30-40% of the patients don't get pregnant after the first embryo transfer. Most of the times, we offer the patient to transfer a new embryo, second embryo transfer, and even third embryo transfer. We tell about this as a cumulative pregnancy rate. This means if we add all the pregnancies coming from the first embryo transfer, the second embryo transfer, and the third embryo transfer, and I want you to know that more than 93 or 95% of the patients are pregnant with one, two, or three embryo transfers. And only the 5-7% of the patients not being pregnant are the ones that maybe are involved in a repeated implantation failure. So sometimes I take advantage of this presentation for explaining this. Sometimes after the first embryo transfer, patients are asking about, oh, doctor, I'm rejecting the embryos. The problem is me and my uterus, my immunology, etc. The repeated implantation failure is not so common if we consider that only by chance not all the good looking embryos will implant, and the cumulative pregnancy rate in these treatments having a lot of opportunities of implanting the embryos after three embryo transfer, most of the patients are pregnant.
All right. Thank you so much for your thorough answer to this. And are you able to tell us about live birth rates then?
Yes, very good question, and sometimes patients are asking about this. We have 10% of miscarriage, so we are not free of miscarriage. My last participation in this meeting was about repeated miscarriage, and 10% of the patients get a miscarriage. So the mean numbers are you need to think about 50-60% of live birth rate.
All right. Thank you so much for that. And you have mentioned this again, but if you can clarify, what stage of embryonic development are the
Yes.
embryos?
I cannot tell 100% of the patients are getting day 5 embryos because we have donated embryos coming from some years before. And
Mhm.
5, 6, 7, 10 years ago, we perform most of the time day 3 embryo transfer. Today, the
Mhm.
gold standard is day 5, and most of the embryos, donated embryos, are
Okay.
day 5 embryos.
That makes sense, of course. So that's changed, and now only 5 day, at least five
Most of
day.
them, day 5
Right.
embryos,
Okay.
yes.
Thank you. Brilliant. For this, and now let's have a look at this question. Hi, had first frozen embryo transfer with donated embryo but did not take, thinking of second attempt, but advised to do myectomy for 6.5 centimeters subserosal fibroid first. How long to wait after surgery before trying again, and how many attempts on average leads to successful pregnancy?
Oh, very good question. Uh, with fibroids, we have some questions to consider. This fibroid is big enough for maybe being a condition difficult in the embryo implantation. And if going to surgery removing this fibroid, there's no general rule. Our protocol usually tells about waiting for 6 months after the surgery for trying to get pregnant. The the the, the thing is that we need to have to recover the uterine wall after this removal and to be strong enough for the pregnancy to go ahead with this previous surgery. So if you consider 9 months of pregnancy and waiting for 6 months, maybe you are more than a year and a half before maybe uh, 12, 13, 14, 15 months, and you are maybe having a good opportunity for this pregnancy to go ahead. How long to wait? How many attempts on average? I think I told about this question. The cumulative pregnancy rate going to egg donation or embryo donation is very, very high. And most of the patients get pregnant in the first embryo transfer. Think about if you have 100 patients and the implantation rate is 60-70%. Most of them get pregnant in the first attempt, and the remaining ones have a lot of opportunities in the second or third attempt.
Okay, thank you again for your explanation to this question. And let me have a look. It's from Mary. I had a laparoscopy for removal of endometriosis 3 months ago. How long should I wait to attempt to try embryo donation?
Very good question. When we have a bound in our skin, it recovers very quickly. Some days later, we have no problem. And I want the patients to know that inside our body, the things look like this. We recover very quickly. So, in my opinion, there's no problem if the surgery of endometriosis is not touching the uterus, and endometriosis, by definition, is not inside the uterus, it's outside. There's no problem to try to get pregnant uh, starting the first period after the surgery. In my opinion, there's no problem at all.
Okay. Thank you again for this question, Mary, and thank you for your help with that. And there are like 3 questions left. Okay, so if you have some more, go ahead, type those in. And let's have a look at this question from Pam. How long do you storage the embryos for that are frozen, right?
Very good question as well. Um, a lot of years ago, I've been working in fertility treatments for 25 years. And I remember the time by the Spanish regulation, we cannot use embryos longer than 5 years old frozen. This limitation was removed in the last regulation because we have all the knowledge, knowing that the time of the embryo being frozen is not important for the viability of the embryo. So there's no limitation for storage the embryos, frozen embryos. I always tell the patients that our embryos could survive us, and the limitation for using these embryos is the health condition of the woman and not the years the embryos are stored in the clinics.
Yes, thank you so much for
No
that.
limitation today for the storage
Exactly.
of these embryos.
And the embryo is remains exactly the same, right? So it doesn't.
Yes, we have few embryos, less today, less than 1% of the embryos not surviving the
Yes.
unfreezing of the embryo. But we know what these embryos are because they are dissolved.
Hmm.
So a few, very, very few embryos, less than 1% today. And
Hmm.
if they survive freezing and unfreezing, they work as if never been frozen.
Okay. Thank you. Definitely good and interesting question. And then actually, next one it's related to this as well. So when the patients don't want their embryos, and what percentage they discharge them or donate them?
This is related with patients being able to ask for donation under 35 years old in the woman and 50 years old in the male. Maybe I have no clear statistic, but my knowledge, because we know about, we tell the patients the options, and sometimes they tell, oh, I would like to help some other patients. They are having the same difficulties we have been suffering, but sometimes are thinking about knowing someone is having a baby coming from. Maybe half of the patients are on one side of the decision and half of the patients in the other side.
Okay, understood, of course. Thank you so much, Sergio. Definitely interesting question as well. Okay, this question is not related as the patient mentioned, but I think we can take a look. Okay, what fertility drugs will you recommend for someone who had miscarriage and have been trying to conceive for over 2 years?
Maybe this question will be for the last webinar, but
True.
I'm very pleased to answer. It depends in if we find any condition that could tell about promoting this miscarriage. We have a lot of testing about thrombophilia factors, immunological factors, endometrial receptivity factors, and anatomical conditions in the uterus. So it depends if you find any alteration or not. If thrombophilia, maybe anticoagulants, low dose aspirin, heparin, more active folic acid. If some uterine condition, we were telling a moment ago about fibroids. Sometimes we don't look fibroids as we need to look because we are scared about proposing surgery of the fibroids, removing the fibroids. And sometimes fibroids are involved, some alterations in the uterus, some immunological questions. Some of them are related with active research, clinical trials, etc. Not easy question to answer because it depends if you find some alteration or not.
I definitely understand you would need more details, yes, just to
Yes,
be able to answer. And remember, there is a chance for you to get in touch with Dr. Scared or his team at IVF Live. I'm sure they will be
yes,
happy to help you out. It's
for sure.
always necessary to provide some more details. And of course, thank you for your question. And
You're
there's an
welcome.
answer here. And there are two questions here as well. Let's have a look at this one. Is it possible, recommended to have more than one embryo from the same donor in order to have siblings in two separate pregnancies?
Very good question as well. Sometimes patients are asking for this condition. Uh, we cannot guarantee a number of embryos. We are guaranteeing one embryo that could give you at least one embryo. Sometimes we have more than one embryo, but at least one embryo. And if you succeed with this embryo and you are thinking of increasing your family, this is a good question. If I have more embryos coming from the same egg donor, etc., it's easy for us and it's more natural. But at the same time, we are asking. We don't know if you are getting pregnant in the first embryo transfer, and if you have two embryos, maybe you will succeed with the first and the second one. Very lucky patient, and sometimes you are having a pregnancy in the second embryo transfer, and you started with one embryo and then with two embryos in the beginning, but in the end you are getting pregnant and you have no more embryos. The main message is we never know how many embryos we need for having one child, two children, etc. So it depends. It depends on the personal response, in being lucky enough to getting pregnant, in being lucky in having some extra embryos, but not all the times is the best option. Think that if going for two embryos for having two babies, I repeat, there's no the things doesn't work like this. We have two embryos, we don't have two children. We have opportunities of having two children, but we are looking for the first one. And sometimes, if you have a lot of embryos, maybe you are in the condition of thinking about, oh, and then now I will donate these embryos, but I'm thinking that some children are being in the uterus of a woman. So, very difficult to answer. It has a lot of sense, this question, and I understand when patients are telling about this, but it's not so easy to answer because it doesn't depend on having two embryos for having two children.
Of course, thank you so much. This is more complicated for
Yeah,
sure. So
yeah,
yeah, it's no, I would say yes or no question, right?
yeah.
This is definitely more difficult to answer. But still, of course, thank you for that question. I'm glad that we are talking about this aspect as well. Okay, there is another question from Mary. So is embryo donation success affected by menopause?
A very good question as well, Mary. Um, uh, I tell my patients uh, ovaries get older, but uterus most of the times doesn't get older. So this means that even being in menopause, we can prepare the uterus with hormonal supplementation for being ready to implanting embryos. So the limitation today is here in Spain we have no limitation in terms of age. Over this that age we cannot perform fertility treatments. The limitation here in Spain is more medical or ethical limitation in the Spanish Fertility Society or the general protocols we are applying. Good health in the woman, but we consider sometimes performing these treatments up to 50 years old here in Spain, having very good demonstrated health. Okay, and being in menopause, we could be able to perform embryo transfer and get pregnant a woman being in menopause or uh, premature ovarian failure because we know how to prepare the uterus not having ovarian function, and we know how to prepare this uterus for the embryo to implant.
Thank you for yet another question here. And this might be our final question from Pam, a bit of the previous webinar topic, but I think we can answer, right? I had an ectopic pregnancy after a transfer of egg donation. I'm very worried that it may happen again since one of my tubes were removed. I would like to try again, but what are your recommendations?
Ectopic pregnancy is not so frequent. It is about under 2% of the embryo transfers, and it doesn't depend on where are you placing the embryo, because we check the embryo placement by ultrasound scan at the time of embryo transfer. But sometimes the embryo gets by itself inside the tubes and implants there. So sometimes the treatment of ectopic pregnancy implies removing the tubes. Sometimes one of the tubes. I remember a lot of years ago, my gynecological reproductive, the fertility treatment manual or book was telling about if one woman having ectopic pregnancy and involved in vitro fertilization treatment and is going to be removed the tube because of an ectopic pregnancy, you must consider removing the other, the contralateral, the other side tube at the same time. I know few people acting like this. They sometimes remove the tube with ectopic pregnancy, and the probability of having a new ectopic pregnancy in your remaining tube is very, very, very low. So at this point, it could happen. You can have a new ectopic pregnancy in the other side, but the frequency of ectopic pregnancy in fertility treatments is very low. So I will not be scared about this embryo transfer, and I will act as usual.
All right. Thank you so much for reassurance here for sure. So Pam, and of course the rest of you, best of luck as always. We keep our fingers crossed to everyone. And of course someone is typing, so I want to make sure that we have answered all the questions. Thanks everyone for your questions and for being here tonight. I do believe it has been useful for you. And there's another thank you. So we will be finishing for tonight. So again, thank you so much, Dr. Izquierdo. It was definitely an interesting session tonight. Before we finish, anything else you would like to add?
Thank you all. Thank you, Caroline, and thank you all the attendants of this meeting.
Thank you so much indeed. I just want to add that we will be back on Thursday. There is another webinar. We will talk about male fertility. So if you haven't signed up yet, I just hope that you will be able to join us. This is a part that I think, still don't talk enough. So I hope you will be able to join our next webinar with Professor Cheryl Homa. And of course, we will be back next Tuesday as well. So thank you everyone for joining. Hope you will have a great evening. And of course, Dr. Izquierdo, till our next webinar. Okay?
Thank you. Bye-bye.
Thank you so much. Take care. Bye.
Bye.